A healthy environment in healthcare is not just a necessity, but a right to both patients and staff. Good morning, everyone. My name is Dr. Jessime de Guzman, the Assistant Head of the Public Health Unit, and I will be sharing knowledge on environmental health. By the end of this lecture, all employees will understand environmental health. Second, identify key environmental hazards in a hospital setting. And third, practice risk management techniques. So, what comes to your mind when you hear environmental health? Para po magising ang inyong mga diwa, I would like all our participants, to those who are online, to please chat in the or type in the chat box what comes to your mind when you hear environmental health, and for our physical face to face participants to write in any piece of paper. All right, I can see your answers. Okay. So, most of us, when we hear environmental health, we think of pollution, tree planting, sustainable energy, waste segregation, and anything about being a green hospital, right? Of course. Though your answers are right, okay? Those are part of environmental health, but there is so much more. Environmental health refers to the aspects of human health that are determined by physical, chemical, biological, and social factors in our environment. In other words, ito po yung mga aspeto na nasa ating kapaligiran, nasa ating environment, na nakakaapekto po ng ating kalusugan. Sa hospital, this includes air safety or air quality, water quality, waste management, chemical safety, and infection control. Ito po ang key components, and ensuring a healthy environment is crucial for patient recovery and staff well-being. So ngayon, isa-isahin po natin itong key components ng environmental health along with its principles. First, we go to good air quality. This is essential to prevent the spread of airborne diseases and improve overall health. Hospitals should ensure that proper ventilation and the use of HEPA filters, we call it, or high efficiency air filtration systems with regular maintenance is in place. So, for our hospital setting, we have these common types of ventilation. We have the natural ventilation or the neutral one, positive pressure, and negative pressure. In this slide, it illustrates the differences between the three. So, most commonly, we use the positive pressure room for our protective isolation, for our operating rooms, and sterile supply areas. For negative pressure rooms, nauso po ito nung COVID-19 pandemic because we keep our infectious patients in our infectious isolation areas. We also have negative pressure rooms in our COVID labs and our decontamination areas. For water quality, safe water is also important for hygiene and also, of course, employee and patient care. So we are required to have regular testing and maintenance of water sources, and hospitals should use certified water filtration systems and also ensure proper storage and handling. This is Also, in line with the Sustainable Development Goal number 6, clean water and sanitation. For the next key element, we have waste management. Of course, our hospital is already implementing this. Proper waste management prevents environmental contamination and health hazards. Waste should be segregated into biological, chemical, and other categories to ensure that there is no mixing and we have precaution for the staff handling this waste. So I think it also encourages us to follow strict protocols for disposal and recycling. Next, we have chemical safety. We see this usually in the laboratories. So, chemicals used in hospitals must be handled and stored safely to prevent exposure. We need to properly label them and secure storage. And of course, our staff should be trained on how to handle these chemicals, including the use of the proper PPE. So we have this material safety data sheet or MSDS that should be in place in the area or the hospital workplace where these chemicals are located. Next is infection control. So this is an infographic or an IEC from the DOH which is very timely. Ngayon na po na tag-ulan. So we also encourage infection control to prevent hospital-acquired infections for our staff. We use hand hygiene, sterilization, and the use of PPE, which are fundamental practices of infection prevention and control. We also follow standard operating procedures to ensure that this is maintained. And the last key component of environmental health that is applicable, I think, for all types of healthcare workers, this is ergonomic safety. So, ergonomic safety, as part of environmental health, ensures that there is a reduction of the risk of musculoskeletal injuries, mga back pain, neck pain, or even serious bone injuries. So we need to train our staff on the proper lifting techniques and provide ergonomic equipment when available. We need also to regularly assess and help identify our employees to address ergonomic risks. Now that we see all these elements, we now go to the roles and responsibilities of each key player in a hospital workplace on environmental health. So, for the management, they are encouraged to establish and enforce health policies. So, sila po yung gumagawa ng mga SOP, mga procedure, and also allocate budget. Sila po nagdedesisyon sa training natin and also to monitor and evaluate these policies and programs. Employees are encouraged to follow our rules and safety protocols, participate in programs, and report environmental health hazards or violations, and implement best practices for infection control, waste management, and chemical safety. Our patients as well has a role to play. They have a role to play. They must follow our protocols, report any environmental health concerns to hospital staff, and participate in maintaining a clean and safe environment. Now we go to identifying environmental hazards in our hospital or in our workplace. So, our hospital face various environmental hazards, including biological, chemical, physical, and ergonomic. So, in the slide, you can see examples like biological. Ito po yung, for example, sa COVID-19 na nasa mask, medical waste, chemicals such as laboratory agents I mentioned a while ago, mga disinfectants included. We have physical, radiation, noise, glass, ergonomic lifting, or repetitive motion. Pero para mas maintindihan po natin, we will now go to a definition of risk. So magkaiba po talaga sila. So yung hazard is anything that can harm or a potential source of harm, while risk is the probability or chance that a person will be harmed if exposed to a hazard. So for example, ito sa picture niyo sa left side, we see a banana peel sagging po sa floor. So this is a hazard. And this hazard has a chance or a risk for people to fall. So there's a falling risk or risk to fall. Pa-fall. Hindi. But now that we have understood the definitions, we now go to a few exercises to practice identifying hazards in our workplace. Okay, so what hazards do you see? Please type in the chat box. Okay, time's up. Actually, we see, I see three. Maybe I missed some of them, but for now, we see a physical hazard, radiation from the CT scan. There's an ergonomic hazard, awkward posture, and probably they lifted the patient from the stretcher to the CT scan. And we have biological hazards. There may be pathogens in the patient's mouth, or maybe the patient has a CT tube or a urine bag, which can also be a hazard for these two healthcare workers. Okay, let's go to the next exercise. Please type in the chat box the hazards that you see. Okay, let's go to the hallway. So, nandito po si ate, Star. Yung ating mga IWs na malaking tulong po sa atin. So, what are the environmental hazards? So, I think I could identify four, four classifications. We have the posture of the IW or the healthcare worker. We have chemical hazard, the disinfectant, the cleaning agent. We have a trash bag here, which contains medical waste. This can also contain pwede din pong may glass or sharps. And of course, a floor. We don't know, we can see. There may be pathogens. Okay, so I think may nakakuha naman po ng ating mga hazard identification. We are down to the last exercise for this part. We now enter the laboratory. So type in the chat box or write in your paper the hazards that you see. Okay. So I think I see a lot also. Madami ding na-identify ang ating mga employees. Very good. So we see an ergonomic hazard, an awkward posture by this medical technologist or doctor, pathologist on the left side. We have a corrosive substance hiding there, chemical hazard. We have a bright light here, physical hazard. Meron pong mga glass dito, which can be a physical hazard as well. And we have specimens that may contain pathogen. And siguro wala sa picture, some of our laboratories have Bunsen burners with flames that can cause this a high risk for burns. So that can cause burn injuries. So I think you're well prepared to identify environmental hazards in the workplace. Now we go to the last part, risk management. So for risk management, you have to just remember the hierarchy of hazard control. So by the order of the most effective to the least effective, we see na yung pagtanggal po sa hazard yung pinaka-effective, followed by replacement. Next will be engineering or isolating the people from the hazard, and administrative controls next. And the last, or the least effective, is PPE. I think most of you are familiar with this or not, pero ito po yung hazard control or risk management techniques that you have to remember. Now, to learn more about this, let's have actual examples and we go back to our earlier photos, okay? So, for example, this one for the physical hazard radiation. So, the first and the most effective control technique or method or measure is to eliminate CT scan and use MRI ultrasound when they can provide the necessary information. But if it's not possible, we can substitute. So we substitute a high dose with low dose techniques when it is possible. And next, if it's really not possible, we ensure that the staff or the room itself is properly shielded. So that's engineering control. Next, for administrative control, we can implement SOPs. Of course, we provide training for staff in the use of the CT scan and how to ensure patient safety as well. And the last control measure is to provide personal dosimeters, lead aprons, and thyroid shields, and the likes of the PPE. Okay, so that's an application of the hierarchy of controls. Now we have the last exercise for you guys, for our participants. Okay, so this is the most common. I think everyone can relate. Let's all brainstorm together para sa ating sakit ng likod, our low back pains, our musculoskeletal injuries. Ano po kaya ang pwede nating gawing measures to control this environmental hazard? Okay, I'll give you a few seconds to type in the chat box some of your bright ideas. Okay. Okay. All right. So these are just some of the methods or measures for risk management or to control ergonomic hazards. We have in this table, according to the hierarchy of controls, we have elimination through automation, substitution, engineering, admin controls, and PPE. So I will not go over them one by one in the interest of time. Okay, so I think you had a brief overview of hazard identification, risk assessment, and control. And in closing, remember that maintaining a healthy hospital environment is a collective effort, and each of us has a role to play in ensuring safety and health for patients and, of course, for us staff. Let's commit to making environmental health a priority in our daily practices. Once again, thank you for your time and attention. Good morning, everyone.